You don't see as well as you used to. Maybe you have already been to an ophthalmologist who told you that you need visual aid. That's what this video is about. Many of you may have noticed that you no longer see as well as you used to. Maybe you have already been to an ophthalmologist and found out that you have vision problems that require visual aids. I understand that this news can be overwhelming and raise many questions. Therefore, here are 3 options for correcting emmetropia. First of all, glasses. This is the most traditional and simplest method of correcting vision defects such as nearsightedness, farsightedness, astigmatism, and presbyopia. Emmetropia results from irregularities in the shape of the eye that result in light not being focused correctly on the retina. So what is our problem? Basically, what we want to have is that the light which comes on our cornea is basically refracted right on our retina. So here in the posterior part of the eye. And the problem which we have in short-sightedness, it is not at the retina, but before the retina, and in farsightedness, it is behind it. Okay, astigmatism is much more complex. Just to give you a quick view on how this looks. In astigmatism, you have got basically most of the time a higher refractive power in the vertical plane than you have got in the horizontal plane. And this causes a refractive error. So when you want to correct this, it is possible with glasses and with contact lenses and with laser surgery, of course, as long as it's regular. If it's an irregularity, so it's not like in one plane, but imagine like it's here, here, and there, then you cannot correct it anymore with glasses, but you have to wear contact lenses or get refractive surgery. But what if you don't want to wear glasses, or if you've got an irregular emmetropia? Contact lenses provide near natural vision correction and are available in a variety of forms, including daily, weekly, monthly, and specialty continuous wear options. They are particularly popular with young adults and people who are active in sports because they have less of an impact on appearance and are more practical than glasses during physical activities. Contact lenses are thin, transparent lenses that sit directly on the surface of the eye. They correct vision problems such as nearsightedness, farsightedness, astigmatism, and presbyopia, and even irregular emmetropia by optimizing the refraction of light on the retina. And how do they work, and how can they basically improve your the irregularities? Let's look at this. Imagine this is your corneal shape. We see like there are the small hills which we have on our cornea. We couldn't correct this with glasses because glasses can be only used for regular emmetropia. But with a contact lens, you can basically cover these irregularities, and we have got like the clean surface of the contact lens, which then can improve also irregular vision problems. According to a study in the Journal of Ophthalmic and Vision Research, modern silicone hydrogel contact lenses can transmit significantly more oxygen than older materials. These materials allow up to 5 times more oxygen to reach the eye, promoting corneal health and reducing the risk of complications. And this is really crucial. I just recently had a patient with me who was using her contact lenses for a couple of years, all the time the same, basically the lenses from the same company. And I told her like, okay, they aren't so gas permeable. So I basically recommended her to go again to an optician and get other type modern contact lenses. And when she used them, she said like she has got significantly less issues with her contact lenses. They were not irritated anymore, their eyes were not irritated anymore, and she could wear the contact lenses for a longer period. So I would really recommend you, if you are using old contact lenses, basically from a material which is from a long time ago, I would definitely recommend you to go again to an optician and maybe check for a new material which is more gas permeable. So a key benefit of contact lenses is their ability to provide a more natural viewing experience. They cover the entire field of view without frames or edges restricting vision, and they move with the eyes to ensure consistent vision quality. In addition, they do not fog up and are ideal for sports activities. According to the American Optometric Association, approximately 45 million Americans use contact lenses, underscoring their popularity and effectiveness. However, contact lenses also require diligent care to minimize the risk of eye infections. It is important to clean them daily and use special solutions to remove deposits and microorganisms. A study from the Centers for Disease Control and Prevention has shown that properly caring for and regularly replacing contact lenses significantly reduces risk of infections such as keratitis. In conclusion, if you are looking for a discreet and effective way to correct your vision, contact lenses can be an excellent choice. Constantly wearing glasses or contact lenses can be annoying in everyday life. People who wear glasses must constantly remember to take the glasses with them everywhere and keep them safe. You often experience fogging of the glasses when moving from cold to warm environments, which can be particularly annoying in winter or when cooking. In addition, glasses can slip or even fall during sporting activities, which is both inconvenient and risky. Contact lens wearers face different challenges. They have to plan time for inserting and removing lenses every day and always need proper hygiene to avoid infections. The risk of dry eyes and irritation can also make wearing contact lenses difficult. All of these factors make the visual aids feel stressful and restrictive in daily use. Thanks to the most modern technologies, emmetropia can now also be corrected in another way, and that's laser eye surgery. One of the main reasons people choose surgical procedures is a desire for a life without glasses or contact lenses. In fact, a meta-analysis in the Journal of Cataract and Refractive Surgery shows that more than 96% of LASIK patients achieve visual acuity of 20/20 or better. Interestingly, in many cases, laser eye surgery actually poses fewer risks than long-term wearing of glasses or contact lenses. While glasses can break or cause injury during sporting activities and contact lenses increase the risk of infections such as keratitis if not handled properly, the risk of a one-time LASIK procedure are surprisingly low. Studies like the one published in the Journal of Cataract and Refractive Surgery show that the chance of serious complications from LASIK is less than 1%. Additionally, many patients experience an improved quality of life after surgery, free from the everyday inconveniences and limitations associated with glasses and contact lenses. This makes laser eye surgery an attractive and often preferred choice for correcting refractive errors, especially for active and working people who are looking for a permanent solution without daily risk of glasses or contact lens problems. When it comes to laser eye surgery, there is not just one method but several procedures, each offering their own advantages and specific applications. We have already discussed each of these procedures in detail in previous videos. If you are interested in more in-depth information about a specific method, please watch the corresponding video on my channel. Today, however, we will briefly summarize the most important points about the most popular and newest techniques, including LASIK, PRK, and SMILE. These procedures have the potential to significantly improve your vision and give you a new quality of life. Let's take a look at what makes each method unique and who it might be suitable for. LASIK uses a special laser to precisely reshape the eye cornea. This corrects the way light hits the retina and significantly improves visual acuity. According to a study in the Journal of Cataract and Refractive Surgery, about 96% of patients achieve 20/20 or better, as said, after LASIK surgery. This impressive result makes LASIK one of the most effective treatments in ophthalmology. The procedure itself is quick and most patients can enjoy the improved vision almost the next day. The laser process only takes a few minutes per eye. First, a small flap is created in the cornea to reach the underlying area, which is then treated with the laser. After adjustment, the flap is placed back where it heals without the need for stitches. Let me show you how this actually looks like. So when we've got the situation that basically you are, for example, nearsighted, we've got the situation that the refractive power of your visual system is too high for the length of your eye. So basically, the focus will be in front of the retina. And what we will do in a LASIK procedure is basically we will first create a thin flap in the cornea, then we will remove corneal tissue, and then we'll put the flap back on the eye. And by removing this corneal tissue, you will basically reduce refractive power and get the focus right on the retina, at least when it comes to short-sightedness. In farsighted, it's the other way around. There you have to basically reduce the peripheral power, if you want to say so, and increase the central power. And this you can do by removing tissue in the periphery, and this will cause a steepening, a central steepening, which will increase the refractive power and also treat farsightedness. Despite the high success rate and quick recovery time, there are certain risks with LASIK. Possible side effects include dry eyes and slight vision changes during the healing period. However, in most cases, symptoms are temporary and can be treated successfully. Recovery time is typically short, with many patients reporting being able to resume normal activities within a day of surgery. Especially for patients where the recovery time, where it's very crucial to them so that they want to basically work the day after, I usually recommend them to do LASIK surgery. This is the ones where the recovery period is definitely the shortest. Careful follow-up care is crucial to ensure optimal results and minimize the risk of complications. Now, if you are considering a permanent solution to your vision problems, it is important that you consult with a qualified eye doctor to determine whether you are suitable for LASIK. This procedure offers many people the freedom to see clearly without having to rely on glasses or contact lenses. Another method, PRK or photorefractive keratectomy, is particularly suitable for people with thinner corneas or with very irregularly shaped corneas. Unlike LASIK, where a flap is created in the cornea, PRK removes the top layer of the cornea, the epithelium, and then shapes the underlying cornea with an excimer laser. So it's a bit different than what we had with LASIK, so where we said we will create a thin flap, yeah, so we basically do a cut in LASIK. What we do in PRK is we just remove the top layer and get directly to the center of the cornea to remove the tissue there. So it's a bit different, it's a surface procedure if you want to say so. Overall, this technique has evolved greatly since its introduction in the early 1990s and is now valued for its safety and effectiveness. One of PRK's strengths is its security. Without the need to create a flap, the associated risks such as flap displacement or complications like severe dry eyes are eliminated, or reduced at least. This makes PRK a particularly good choice for patients with thinner corneas or for those involved in jobs or sports with a high risk of injury, for example, any kind of combat sports. A study in the Journal of Refractive Surgery showed that PRK provides long-term stable vision results with over 90% of patients achieving 20/40 or better visual acuity 1 year after surgery. Despite its high success rate and safety, PRK is not without its challenges. Recovery but will take longer than LASIK, with more discomfort in the first few days after surgery and a longer time to get to full vision, sometimes even several weeks to months. Patients must protect themselves during this time by using eye drops and avoiding direct sunlight to promote healing and maximize comfort. In summary, PRK offers an excellent option for many people seeking permanent vision correction without the risks that can be associated with other procedures. When considering whether PRK is right for you, it is crucial that you seek advice from an experienced ophthalmologist who can evaluate your individual needs and circumstances. In my private practice, I rarely do PRK because, as said, the recovery time is quite high. It can be a bit painful in the beginning, and the results are not as good as LASIK. So we do usually PRK when the cornea is too thin or someone is, for example, into combat sports. A newer technique is actually SMILE. SMILE stands for Small Incision Lenticular Extraction. It requires only a small incision. SMILE is a minimally invasive method that does not require the creation of a corneal flap, which is common in a procedure like LASIK. Instead, a high-precision laser is used to make a small incision, less than 4 mm in size, through which a small piece of corneal tissue called lenticule is removed. So there is like a tunnel which you can then take out this lenticule out of your cornea. This change in the corneal structure helps focus light correctly on the retina. The benefits of SMILE are remarkable. According to a study in the Journal of Refractive Surgery, more than 88% of patients who underwent this procedure achieved 20/20 or better visual acuity 1 year after surgery. This high success rate makes SMILE an attractive option for many who want to be independent of glasses or contact lenses. Another significant benefit of SMILE is a reduced risk of dry eyes. Research has shown that patients report less dry eyes after LASIK surgery than after SMILE surgery than after LASIK. This is particularly important for those who were already experienced dry eye symptoms before surgery. The security of SMILE is also a critical factor. Since no flap is created, the associated risks such as flap displacement or detachment are eliminated. This is particularly beneficial for people who lead active lifestyles or who are at increased risk of facial and eye injuries. The recovery time for SMILE is typically short, a bit longer than LASIK, but considerably less than PRK. And this makes it a method which is also attractive from a practical perspective. In conclusion, SMILE is an excellent choice for correcting myopia and astigmatism. It is a safe, effective, and gentle alternative to other refractive surgery procedures. If you are looking for a permanent solution to your vision problems and prefer a less invasive option, I think SMILE could be the right option for you. In summary, all surgical procedures carry risk. A thorough preliminary examination and consultation with a qualified ophthalmologist is essential to determine whether you are suitable for the operation and which procedure is best for you. If you have any questions, please do not hesitate to contact us or leave us a comment under the video. Please also take a look at our other videos about laser eye surgery. Until then, looking forward to see you. Thanks a lot. Ja, eben, das finde ich zum Beispiel.
Ja, ich weiß, das kann ich mir schon vorstellen.